My capstone project is entitled Yes You Can, Promoting and Facilitating Breastfeeding, and that's by me, Hillary Telegan. Did you know that breast milk is the ideal form of nutrition for infants? Breastfeeding promotes maternal-infant bonding, and breastfeeding confers a multitude of health benefits upon the infant and the mother. There are a lot of infant benefits. Breastfed infants are at a decreased risk of asthma, otitis media, atopic allergies, cardiovascular disease, type 2 diabetes, SIDS, pediatric cancers, and childhood obesity. Breast milk is dynamic in that it changes to meet the nutritional requirements depending on the age and need of the infant. It contains the necessary amino acids, fats, and nutrients and enzymes for good health. And it also contains white blood cells. So that promotes immunity against numerous infectious diseases that the baby could possibly get. All right. Maternal benefits to breastfeeding include postpartum weight loss, lactational amenorrhea, and ovulation suppression. Breastfeeding mothers are at a decreased risk of postpartum hemorrhage, diabetes, cardiovascular disease, and reproductive cancers. Breastfeeding is not only just understood through research and evidence that it is the best form of nutrition for a newborn, it is also promoted and supported by various organizations and institutions, including Healthy People 2020, the Institute of Medicine, the Surgeon General, the American Academy of Pediatrics, and the Centers for Disease Control. Also, which I don't have on here, it is supported and recommended by the World Health Organization. The World Health Organization recommends exclusive breastfeeding for the first 6 months of an infant's life. So the goal of these organizations, the recommendations, is to reduce the proportion of breastfed newborns who receive formula supplementation. The World Health Organization is very big on that. Hospitals and healthcare providers should use maternity care practices that empower new mothers to breastfeed. They should work to promote exclusive breastfeeding for the first 6 months. This is the basis for many hospital initiatives that are out there now to improve maternity care and increase breastfeeding rates for postpartum moms. So, what do nurses have to do with this? Why the nurse? How does this influence nursing? Well, nurses have various roles. The nurse's role is to improve patient care and outcomes, provide competent care. They spend the most time with their patients, and one nursing role is that of educator. So the research shows that mothers that feel rushed by providers are less likely to express concerns and ask questions freely regarding breastfeeding. So I already mentioned that nurses spend the most time with the patients, and lack of availability of lactation consultants to fully meet demand for services is also an issue. So there's this gap that needs to be filled with patient teaching. And nurses are the largest group of healthcare providers able to provide breastfeeding education. They can use evidence-based research and information to enhance their practice and to improve patient outcomes. So, What do nurses know about breastfeeding education? There's definitely a gap in breastfeeding knowledge. This is due in part to the fact that it is not included as a standard part of nursing school curricula. Upon graduation, new nurses lack the breastfeeding knowledge, attitudes, and skills necessary to adequately assist patients. Another problem is that some nurses do have personal experience with breastfeeding and some do not. Some nurses view breastfeeding positively and some do not. To remedy this and all of these differences and lack of education, many facilities are providing in-service programs to nursing staff so that they can provide competent care to postpartum mothers and infants regarding breastfeeding. Patient demographics. So we are carrying out this study, this educational program at an acute care hospital who serves a majority of Hispanic mothers and infants in the labor and delivery unit. There is also a large number of African American mothers. Many of the patients are from a low socioeconomic level. A lot of them or their partners are seasonal workers, and many come in with illicit drug use or cigarette smoking. So those issues need to be addressed as well. Minority group status and low socioeconomic level often go hand in hand. Many have some type of Medicaid insurance and are more likely to utilize services such as WIC. Since the inception of the Affordable Care Act that made insurance more available to more people who were unable to access insurance in the past, Medicaid insurance has become more prevalent and affordable, different plans. And usually if you are of a low income, you qualify for WIC. So you can get free food for your baby. WIC is one of the largest purchasers of infant formula in the United States and is often given to WIC benefit recipients for free or at reduced rates. So even though WIC does promote breastfeeding, they're kind of defeating the effort because they are giving out free formula. So this is causing reduced breastfeeding rates. Reduced breastfeeding rates are also related to culture. In some cultures, it's not acceptable to breastfeed, or the woman defers to her partner or other men in the family regarding breastfeeding and whether they should or not. So that is a major factor as well. And this is all important to take into consideration when designing a program, so you know what type of patients you are working with, so you can address this in the educational program. So, who are the stakeholders? Who is this important to? So first of all, we have the hospital administration. I guess that's the highest level here. So how does this affect them? So Joint Commission accreditation. So the Joint Commission has implemented some things for accreditation, some caring issues that involves increasing breastfeeding. They want to see that more. They want to see the promotion of breastfeeding, an increase in the initiation of breastfeeding and the continuation of breastfeeding. It also, a program like this helps towards baby-friendly designation if the hospital wants to go in that direction. Part of the 10 steps to successful breastfeeding, which need to be followed in order to become a baby-friendly designated hospital, One of those steps involves in-servicing and education of the staff on breastfeeding. Breastfeeding improves health outcomes, as we have already discussed in the beginning of this presentation. It also decreases cost because research shows that infants who are breastfed are healthier. They have less pediatrician visits for illnesses, less hospital days for illnesses, less prescriptions from pharmacies. They're just healthier. So that decreases costs. Then we have program funding. There are incentives for hospitals to do better with their breastfeeding initiation and continuation rates. For instance, hospitals who are doing this can receive funding from the CDC, the Centers for Disease Control. These funds are available for hospitals that wish to implement some type of quality improvement program regarding breastfeeding. Then we have the labor and delivery nurses. They are also stakeholders. This is good for them because it's continuing education, and nurses need to stay current with evidence-based practices, which that's next, evidence-based practice. We want to provide the best, highest quality of care for our patients. And like I said before, a role of nurses is patient teaching. Then we have postpartum mothers. So we mentioned earlier some barriers to breastfeeding, like race, culture, ethnicity. There are also psychosocial barriers to breastfeeding as well. Lack of education, lack of self-efficacy or confidence in breastfeeding, socioeconomic factors, and we just mentioned the patient education. So what is the theoretical framework for this project? I will be using Benner's model of skills acquisition. Okay, so that means that before you learn something, or right at the beginning, you're starting out as a novice. And then as you gain experience and education, you become an advanced beginner. And then you become competent, and then proficient, and finally an expert. And that is our goal here, to make the nurses experts in breastfeeding, teaching, support, and guidance to give the highest level of or quality of care to the patients. Quality of patient care increases as the nurse becomes more of an expert. Expert level can be reached through experiential learning, whereby the learner develops competencies, skills acquisition, clinical knowledge, and practical knowledge. The Benner model has been used extensively as rationale for career development and continuing education in nursing. So that's why I chose this model. All right, so then we have the educational program itself. So it was decided with my mentor that it would be a 4-week program for labor and delivery RNs. There will be 4 2-hour weekly modules. We will be using the flipped classroom format. So the classroom time will be used for interactive learning activities, and preparation will be done outside of class. So to make it more convenient for everybody, I thought it would be a good idea that the articles and videos for each class would be emailed to students prior to that class, probably a week before, so they have a chance to read the articles and watch the videos. And in class, we will be using different methods of interaction to review and discuss what was in the articles and videos. And so logistics is a little bit of a problem here. So the plan was to schedule these classes at change of shift to increase attendance And so the nurses won't be taken away from their job activities, and so it won't be a hardship for them to come in on their days off at odd times and things like that. So that was our idea initially. Project outcomes. We have 3 outcomes. First of all, the RNs will demonstrate an increase in breastfeeding knowledge and skills. Then postpartum mothers who choose to breastfeed will express satisfaction with breastfeeding, teaching, and support. And the rate of breastfeeding initiation and continuation after hospital discharge will increase. So this is in keeping with national initiatives like we discussed earlier to increase breastfeeding initiation and continuation rates. Data collection is necessary to identify benchmarks and goals and to mark progress. This will be like really helpful for Joint Commission accreditation and for their plans anyway to gather data from hospitals in the United States on breastfeeding rates. So this is a very good way of doing that, and I think it would help towards accreditation to show that the hospital is gathering this data so that they can analyze it and make a difference. So how are we evaluating the effectiveness of this program? Well, first of all, we have a pre-test and a post-test. So I have created a 20-question multiple choice test from a test blueprint using Bloom's taxonomy and different levels of cognition. And it's based on the content of the course. So the pre-test and the post-test contain the exact same multiple choice questions. And the plan is to just change the order of the questions for both of the tests. So the outcome for this would be that the post-test scores will show at least a 50% improvement from the pre-test scores. In phase 2, this is further down the line, patients who have been taught by nurses who have successfully completed the educational program will fill out a patient satisfaction survey. How satisfied were they with the teaching support and guidance that they received? Did they feel like the nurses spent adequate time with them? Were their questions answered? Are they more at ease with the physiology and mechanics of breastfeeding? Did the nurse assess their level of understanding and any other factors going on with them that may influence their ability to breastfeed, and so on and so forth? And then upon discharge, there will be follow-up phone calls after discharge at 3 and 6 months postpartum to determine the rate of breastfeeding continuation. So postpartum mothers who breastfeed will express satisfaction with breastfeeding, teaching, and support. Like I mentioned, that's the plan and the outcome we hope for from the surveys. And there will be an increase in breastfeeding initiation and continuation rates as reported by discharged patients via follow-up phone calls at 3 and 6 months postpartum. So that is what we are expecting the outcome to be from this educational program. So an unanticipated outcome. The capstone course is a 15-week course. It took me longer than I thought it would to develop a course outline, objectives, multiple choice questions, locate supplemental materials. I did revise my course outline a couple times on the advice of my mentor. Just planning with administration, the director of nursing, the nursery unit manager. So approval and planning for a 4-week program exceeding the time of the capstone course, that was an issue because we would have to seriously organize this within the department, set up times, set up dates, do this for 4 weeks, then the phase 2, then give the post-test, evaluate the post-test scores and compare them to the pre-test scores. Phase 2 evaluation, data will need to be gathered over a longer period of time. We would have to have a significant number of patients complete the satisfaction survey, be discharged from the hospital. This would take a considerable amount of time. So what is the significance? For hospital administration, the Joint Commission accreditation perinatal care core measures, like I mentioned before, it will help gather data to monitor breastfeeding initiation and continuation. 10 steps to successful breastfeeding, it's part of that as well. Like I said, education is one of the 10 steps, so that could be used towards baby-friendly designation. For nurses, remaining current with best practice guidelines and updating policies, lifelong learning, and postpartum mothers needed teaching, guidance, and support, and reducing healthcare disparities. So, like I said, it'll help meet national breastfeeding goals and lead to a change in practices based on evidence and improve quality of care and patient-centered care. What is the significance beyond the current application to the profession of nursing? Breastfeeding versus infant formula, bottle feeding. Many people out there are still bottle feeding. There's a huge lobby from the formula companies to promote formula feeding, even though breast is best. A generation is removed from breastfeeding. Mothers who wish to breastfeed these days really can't ask their mothers or family members in the previous generation for advice or help because they really didn't breastfeed their babies, so they can't offer a lot of support. Social and media influences, you know, they encourage bottle feeding, you know, the sexualization of the breasts. It's something sexy. It's not something functional for feeding your baby. Breastfeeding in the working mother. Not a lot of workplaces provide ample time or space for pumping breast milk. So, you know, that doesn't really encourage mothers to keep up with that to feed their babies, and a lot of them end up stopping because we don't have that as part of the breastfeeding culture in place. So I think significance of my study here will be to normalize breastfeeding in the future, that this is the best way to feed babies and that we need to help and support women who wish to do that any way possible. So that is the end of my presentation. References. The rest of the references. And thank you very much. It was a pleasure. I hope you liked it.